It is a surgical amputation. It is especially it is called as or considered as the removing the dead or unhealthy tissue that cannot be treated by any other means. All right. So we know that if a patient is having some massive road traffic accident or maybe some kind of crush injury where the limb is not able to like is not able to the limb maybe the survival of the limb or maybe the vascularization or circulation of the limb is fully damaged. So in that case the limb is not being able to kept with the other for the circulatory purpose or for any other activities purpose. So for that reason, like those unhealthy or dead tissues, better it should be cut out from the body so that the other part of the body, the normal circulation can be established. So in many cases, if you see, amputation is considered as a life-saving method, right? And if you see into that, the reasons for amputation, which are as trauma including from any major crash injuries, explosion, then any trauma that may necessitate amputation if the extension of the injury is quite severe. So in case like when the injury is extensive injury is present, then definitely for the patient to maintain his life or to that can be one of the major indication that patient need to be taken for an amputation with proper consent, because that is what is the first priority the surgeon need to take decision. Next is the thermal injuries. It can be due to electrical injuries, frostbite, burns, which may be severe enough for amputation to be necessary. Then for peripheral vascular disease, most non-emergency amputations are done because of severely compromised circulation due to vascular disease. So in case like a patient who has a Burgess disease or maybe Raynaud's phenomena, so all these diseases are called as the peripheral vascular disease. So in that case, the peripheral vascular diseases, better a patient need to be taken as a amputation procedure where there is lots of complication and sometimes the life patient's life may be in critical condition if we are not able to amputate the area. Then it can be due to infection. In case of severe infection of the bone or soft tissue of a limb, amputation may be required. Then osteomyelitis and gas gangrene. These are the two important complications after osteomyelitis or complications of the bones where the amputation may be sometimes necessary. Then congenital deformity. In some cases, amputation is advised to remove a deformed and useless limb to permit the fitting of functional prosthesis. Right? In case sometimes, like as we know that there might be congenital abnormalities in the babies, like valgus or varus deformity, clubfoot. So in that cases also, if the condition is very severe or maybe there is tissue damage or maybe there is some life-threatening condition in case of the children or the baby, the surgeon have to decide for the amputation. Then tumors, malignancy that does not respond to any form of therapy. It can be threatens to the metastasize to the bone, often results in amputation of all or part of a limb. Then chronic pain and extremities may be painful because of a circulatory problem or other disease process. Amputation may be indicated if the pain cannot be controlled in any way. In case of some debilitating disorders, like as I told you, a complication of diabetes mellitus, right? The patient has a severe peripheral vascular disease, and in that case, patient is not able to ambulate, patient is not able to continue his normal activities even, right? So in that case also, we need to, patient need to be considered as a candidate for amputation. Then whatever may be the reason, amputation is a major operation. Long range of planning is necessary for the patient's rehabilitation. Continuous care and teaching are necessary while the patient recovers. It is very, very important. Like from the planning till rehabilitation and continuous care and teaching where the patient recover, and especially all this are the responsibility of the nurses when considering the rehabilitation. Obviously, there will be the occupational therapies, there will be physiotherapists, right? There will be counselor, social counselor, support system, but among them, nurses' role is also very optimum in this kind of amputation cases. Am I clear to you, this part?